Hey guys, my name is Alex. I'm a physiotherapist here at the lab. Let me take you through what a typical UCL sprain rehab looks like. So we typically see this injury happen in throwing sport athletes such as baseball, softball, even football. Basically any activity or sport that involves overhead throwing demands, this is an injury that we commonly see. Before we get started, the assessment, we basically look at a couple different things before we get into the rehab side. We look at range of motion, strength, asymmetries side to side, and that goes for the shoulder and the elbow. We also look at grip strength for the athletes as well. And we take a look at any other acute symptoms that they might be having in terms of swelling or pain. So before we get started with the rehab, the assessment process looks a little bit like this. First, we do a simple symptom screening where we look at pain and swelling in the area. Then we move on to more range of motion of the wrist, elbow, shoulder. We look at also scapular control and movement, and also how our trunk is rotating and affecting elbow movement. So the first thing we're gonna look at is elbow range of motion. Sometimes at either end of the spectrum, either too bent or too straight, we can have a little bit of irritation. So we just want to get a baseline measure of how much movement he has. Second thing we want to look at is also shoulder range of motion. So we want to make sure that the shoulder joint itself is moving optimally to not have any extra compensation happening around the elbow. Again, up and out. And then lastly, we're going to check the integrity of that UCL. So we're just going to put a little bit of lateral to medial force through the elbow to see if there's any pain with stretching that ligament. All right, so we're in phase one. Phase one is all about pain and swelling management. We want to make sure that those two things are under control as soon as possible because there'll be large limiting factors in the later phases of our rehab. So the sooner we get those under control, the better. The second thing we want to work on is building back a little bit of control within the muscles surrounding the elbow to provide support to the ligament. All right, so the first exercise we're going to work through is active assisted range of motion. So I'm going to get the client to first move actively his forearm upwards, bending his elbow. And once he feels a little bit of tension and resistance, to gently push with the opposite hand to just gain a little bit more range of motion in the direction we're trying to achieve. So like that, push, gentle. We don't want to cause pain during this, so it should be a little bit uncomfortable but not painful, and then relax. All right, so the second exercise we're gonna do is an isometric bicep curl. We're just gonna get a little bit of stimulus through the bicep. I'm gonna resist his pressure gently, not allowing the arm to move. Hold for about 5 seconds, and then relax. Good. Again, this should not be painful. Let's go again. Push, and relax. So now we're in phase two. This is our strength and capacity building phase. This is where we want to focus on overall strength of the rotator cuff, scapular stabilizers, and the trunk. So the first exercise, we're working on some banded uppercuts. What I want is to start working on some rotator cuff strength in a close position. I don't want the arm too far out from the body. And what we're going to do is just lift the arm straight up, elbow up to shoulder height, not letting the band pull us inwards, and then slowly bringing that elbow back down to our side. So the next exercise we're gonna work on is around scapular control. This is a scapular push-up against the wall. This is gonna start working on those scapular stabilizers between the shoulder blades, but also getting a little bit of light load through the elbow joint itself and supporting body weight. So pushing chest away from the wall and then letting chest sink and shoulders sink forward, and pushing away, not rounding that back. All right, so phase three is all about power and rotation. This is where we start to get the muscles working at much faster speeds and intensities. So the first exercise we're gonna do is just a med ball catch and release. So I'm gonna have this ball held up above my client here. He's gonna catch the ball and he's gonna push it right back up into the air at me. Catch and release. Good. Catch and release. Nice, one more. Release. So the second exercise, we're gonna do a med ball rotational throw. What we're gonna get the client to do in a second is to pivot using his hips, his trunk, and extending his arm to throw the ball against the wall as hard as he can. All right, so phase four is all about our return to throw and throwing specific rehab. So the first exercise we're gonna do is a rotator cuff exercise where we're gonna get those muscles twitching a lot faster, trying to catch and release this ball as quickly as possible to try and get as much stimulus in the muscle as we can. So the next thing we want to focus on is return to throw protocol. So what we try to modify is volume and intensity. So we're going to start nice and easy, gradually building up the throwing intensity and speed as the patient progresses. So most athletes just want to know, when can I go back to throw? After that, it's when can I throw harder and when can I go back to playing? This is exactly why we use criteria-based approach to our assessments and our treatments to ensure that the athlete is perfectly ready to go back to sport with as little potential risk of injury as possible. So if you want a structured criteria-based return to throw plan with criteria-based assessments, call us, book it online for an assessment, and we'll help you get back onto the field.